All right. Good morning again. I hope you are well. Sorry for coming in late. I've had a very rough 12 or so hours, and please pardon me. So, without wasting any more time, today what we are looking at is the relationship of theory to the nursing process and the client's needs. We know that as nurses, when we go to the ward, we are there to meet the needs of the clients. We are there to nurse them back to health. And we are there to provide any assistance that our patients will need in order to recover, gain their health back, or even to have a peaceful death. And we cannot do this without following some specific or structured way of administering our nursing care. And so, for the past few weeks, we've been looking at the nursing theories. And today, we are going to see how we can relate the nursing theory to the nursing process that I believe we all know. Okay, we all know that in Ghana now, one of the fundamental um, structure or model that we follow to nurse our patients is the nursing process. And we are supposed to nurse our patients using this process because it gives us a structured way of nursing the patient so that we provide holistic nursing care. And I believe by now we all know that nursing is an autonomy it's a profession that is autonomous, and also it is unique, and it has its own professional language, professional knowledge, and everything. Okay, there is a science backing what we do. And so today we are going to be looking at how we can use nursing theory plus the nursing process to meet our clients' needs. Okay, so by the end of this session, this is actually a very short lecture. Um, we have two objectives. One, to relate theory to the steps of the nursing process. I believe you know the steps, and so when I get there, I'll be asking you. And then also to apply the theory to the care of our patients. All right, so let's move on. We know that the theories give us organized frameworks. So if you pick most of the theories, they have their own frameworks that help us to understand nursing, and then also helps us to provide the care that we need to provide for our patients. And so if you pick, let's say, Orem's theory of self-care, um, Orem's theory helps us to be able to identify the self-care needs of our patients. It also helps us to determine which ones are in deficit, and then also what kind of nursing support we are supposed to give our patients. And so we are going to use this as a basis to provide the care for our patients. We also know what the nursing process is. The nursing process is something that is taught across every level. Okay, so diploma, degree, we talk about the nursing process. So I want someone to explain to me what the nursing process is. What is the nursing process? If somebody meets you and asks you, oh, I hear that nurses, you have something they call the nursing process. What is it? Hello? Are you guys there? Oh, I have not recorded. Hello? Raise your hand or go to the chat and tell me what the nursing process is. If a first year nursing student comes to the ward and asks you, you are a staff nurse already, you are done with your rotation, you are working. What is the nursing process? Ima, don't just give me an abbreviation, okay? It is not the abbreviation that I am interested in. Okay, Loretta says it is a systematic step-by-step method nurses use to provide individualized, organized, and effective patient care. Okay. Helena says it's a systematic process used to render holistic care for our patients. Okay. A systematic approach to patient care, a systematic and continuous patient-centered framework used by nurses to deliver holistic care, and so on and so forth. I like this definition because it's bringing in an aspect of safety. So it is a systematic, patient-centered, problem-solving approach used by nurses to deliver safe and effective care. All right, thank you. AI is helping us. My tone is low. Forgive me. I've been traveling throughout the night. Got to Kumasi around 2:50, and I had to then feel students are writing exams, so I have to come here early and then teach before we start their exam. So I beg you, if you think my voice is slow, kindly up your volume. Okay. My volume is 100%. I'm speaking very close to the laptop speaker. So please pardon me. All right. So the nursing process, like you all said, is systematic, it's structured, it's made up of steps. It is a continuous process that helps us to render the care for our patients. Okay. And the care that we are rendering using the nursing process looks at every aspect of the patient's care. So it helps us to provide holistic nursing care, safe and effective care. It helps us to provide an individualized care because the nursing process is individualized based. You can't prepare a nursing care plan for two patients using one care plan. It is you use one care plan for one patient, and patients have unique needs. Okay, patients have unique needs. And so when we are delivering this care, it is individualized, it is patient-centered, it has a problem-solving approach because you identify the patient's problems and then you plan, you identify the problems, you diagnose, you plan, you implement, and then you evaluate the care that you are given. And so when we add the theories to it, okay, and it is, should I say, it is a beautiful thing if you're able to do it. Okay, if you pick a nursing theory and then you use it as the scientific basis for your nursing process, okay, it's just a beautiful thing, especially if you use it in areas that you normally would not think that it can be used. All right. And so what we are doing today is to look at how we can use the nursing process plus the nursing theory to provide the care. If you're able to do that, we realize that the care that we render for our patients, one, is holistic, is evidence-based, and it is culturally congruent. And last time we were asking, so are there no nursing theories by what do you call them, Africans? And so with our unique needs as Africans, with our unique cultures. In Ghana here, you have so many different cultures. With those cultures, be it from the religious angle, ethnic, or whatever it is, how are we able to apply those Western-based nursing theories? Well, whichever theory that you pick, you need to apply it in the context of wherever you find yourself. And one of the things that um, um, if you happen to move on from a BSc to a degree, a master's degree, either the MSc or the MPhil, is how to apply the theories well. But I'll try and teach that today. At least you have the basics of it. Okay. And you see that when you are applying your theories, you have to consider the cultural context that you find yourself. All right. So, as the nursing theories provide, oh, what happened to my slides? Okay. So, the application of the theory to nursing practice will help us to care for our patients. The quality of care that we give to our patients would improve. Okay. As the care improves, patient satisfaction and patient cooperation also improves because you are meeting that person's individualized needs. Okay. You are meeting the person's individualized need. And so the person is more satisfied, is able to understand what you are doing and can cooperate fully in the care that you are rendering for the patients. The application of the theory also helps us to bridge the gap between global nursing standards and the unique realities of Ghanaian healthcare systems. So if you pick Orim's theory is on self-care. And one of the things she says is that every individual, it doesn't matter who you are, where you are coming from, you need, there are some basic self-care needs that you should be able to do for yourselves. Okay, so if you're able to do this and you bring it to the context of Ghana, what are our unique needs? Yes, we have all the universal needs, but for us, culture is important. So if you come to food, for instance, where I am from, fufu is a big thing. So if you tell a typical, excuse me to say, Ashanti woman who has diabetes to stop eating fufu, how do you think this person would take this news? Is a patient going to comply or not? And if the patient is not complying, what is the effect on the healthcare of the patient? And so, please, using a theory in the context of our Ghanaian culture helps you to better apply it and also to bridge that gap between global nursing standards and the uniqueness of our healthcare system. Elsewhere, you will find a lot of open wards. You know, in most of our hospitals, we operate the open ward system. Elsewhere, it's individualized rooms, maybe at most 2 to 4 beds, which are they have their own privacy. There are curtains or there's some kind of barrier that prevents one patient from interacting with another, or there are single bed rooms. So if you are applying a particular theory in this context, and we have the open ward system, how are you going to consider the culture or the system that we are applying or we are running in the country? Okay, so even though most of these theories are from the Western world, we are able to apply them in Ghana and in our facilities because we are able to look at how our culture can fit into it. Okay, all right. So moving on, what are the key concepts we are looking at today? We are looking at the nursing theory, the nursing process, and the client's need. So the nursing theory, we all know, explains why nurses we are acting or the way we do our things. Okay. So if I pick again the Orem self-care theory, all right, it helps me to know why I am looking for the self-care needs of the patient. Because when I'm attending to my patients, I know my patients have self-care needs. If she's not able to meet those self-care needs, she has deficits. So whatever I'm doing, the nursing theories is what is explaining why I am doing what I am doing. Okay? All right. Then the process, the nursing process. This explains how nurses react. So if you look at the nursing process, it has 5 steps and it tells us how or exactly what we are doing, how we are doing what we are doing. So you are assessing the patients like Ima said earlier, ADPI. You are assessing the patient, you diagnose the patient, you plan the patient's care, you implement, and then you evaluate the care. Now, all of these evaluation, so it's a whole process, it's a cyclical process. Okay, you are doing it again, while even when you are assessing, you are also evaluation starts from there. And when you are planning, you still do some form of evaluation, some form of assessment. So they are all interrelated. And then it explains how we are working. So a doctor comes or another health professional comes to the ward and sees you with a care plan. They know exactly what you are doing and how you are going about it. Then the client's needs are what the client requires us to do for them. Okay, so every patient that will come to you has a need. It doesn't really matter how sick the person is. Even the person who walks to the OPD has needs. That is the reason why they have come there. And it is up to us as nurses to be able to pick out these needs and then provide the care based on our knowledge in nursing theories and then the nursing process. So these are the key concepts that we are looking at. So does this relationship work? How does this relationship work? So that there are three concepts. We have the nursing theory, we have the nursing process. When you apply a theory to your nursing process, all right, and then you apply that to the client's needs, in meeting the client's needs, what happens is that you improve or enhance client health outcomes. So we know the various theories. We've mentioned a couple of them. We are here to take each of the theories to explain the various theories and how we use it. But we do know the nursing process. Okay, and we know how our patients, the needs of our patients. And so this is the relationship that we are going to be looking at. So let's quickly look at how you can apply the nursing theory to the nursing process. Okay, so we will pick one nursing theory and then we would use it to meet the needs of a particular patient. Okay, so how do you apply the nursing theory to the nursing process? We already know that um, the nursing process has the 5 steps. We know about assessment, diagnosis, planning, implementation, and then evaluation. So how are you going to apply the nursing theory to the various steps? That is what we are going to be discussing. So what goes into assessment? What goes into assessment? What do we do during the assessment phase? What do we do during the assessment phase? Hello, I'm going to be mentioning names. I'm going to be mentioning names because nobody is raising their hands. And I'm not seeing anything except data collection, family history, gather data about the patient, history taking, gather information, physical examination and history, past medical history. So while some are giving us the general um, thing what that you need to do during the assessment, some are also being very specific. Okay, so let's look at it. Assessment, you are looking out for the patient's data. Now, this data, you are basically gathering information about the patient or data about the patient. One, the data can be subjective or it can be objective. Subjective based on what the patient tells you, and objective based on what you see and you measure and you hear as you collect your data from the patient. And then some of the data that we would collect includes what? We will do physical examination, we take the history. In the history, we take medical history, social history, we will take drug history and all of that. And then also you will collect information about the vital signs. We will collect information from the labs as well. So basically at the assessment level, we are collecting data. Okay, we are collecting data. And how does a theory or how can a theory help you in collecting data? The theory will guide, a nursing theory will guide your assessment. Okay, so for instance, again, I am using Dorothy Orem's self-care theory. Dorothy Orem's self-care theory. Let's say my patient is a hypertensive patient and let me use a she's on admission on the ward. And so I am going to use her theory to help guide my assessment. So what would I be looking out for? What are some of the things that I am looking for? Her theory is about self-care and that people have the ability or the capability to provide self-care for themselves. And if for some reason they cannot do that, then they have a self-care deficit. And if they have a self-care deficit, then it means that the nurse have to come in and provide some level of care for the patient. So I am using that to guide my assessment. So what information am I going to look out for? First of all, I have to look out for the self-care of the patient, self-care agency. So what can my patient do? Okay, can my patient take her medications by herself? If the patient is able to do that, then yes. Okay, I will do physical assessment. Please, I think the volume issue, it is um uh, from your end. I don't think it is from my end. Okay, so please check your network and then again check the volume on your device. Okay, maybe you've not increased it, it's still low. Okay, all right. So check your end. All right. So we are using Orem's theory, all right, to determine or to assess our patients. Okay. And we are looking at what we can look out for when it comes to data gathering for the patient so that you can identify the patient's health needs. All right. So with Orem's self-care theory, what she is saying is that patients are supposed to be able to care for themselves. Okay. So if they are supposed to care for themselves, what are the self-care activities or the self-care agency that the patient has to be able to do? Is the patient able to take the medication again? Okay. Does it can the patient eat well when it comes to activities of daily living? Is the patient able to what do you call it? Carry out these activities. So that will help you in identifying the self-care agency and then the self-care deficit. All right. And based on the self-care deficits that you identify, which will turn out to be the nursing, the client's problems, it will help you shape your diagnosis. So if you go through the NAMDA, okay, you have diagnosis on self-care deficits. Please, I believe we know NAMDA. Hello? Do we know NAMDA? Not yes. Oh, somebody says no. Okay. NAMDA is North American Association for Nursing Diagnosis also. Yes, it is the body, it's the international body that helps us with nursing diagnosis. So they have standardized diagnosis for us. Okay, and I'll share the most recent one that I have. They review them quite often. Okay, so I'll see if I can, I'll look for it and share with you on the page. One of you even sent it to me, sent another one to me. Yes. So I'll look for it and then I will share it with you. Okay. So the theory will help us to shape our diagnosis. So for instance, like I was saying, we have self-care diagnosis there. If you go through the NAMDA, you find self-care diagnosis. You find several of them. Okay. Anything to 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 do with self-care deficits. Okay. Theory, diagnosis, you get some. Okay. It can be from the knowledge ones to ineffective health management. So you look at the disease, the patient's health problems, and then you can come up with your diagnosis, and it will shape the diagnosis in such a way that it will, I mean, it becomes easier because some of us have challenges when we are writing out our diagnosis. Okay, so usually it is the problem, what is causing the problem, and then the signs or symptoms. That's how you shape your diagnosis. Okay. So it can be if the person is not able to uh, perform the activities of daily living, depending on the specific deficits. You can have self-care deficits. Maybe it is grooming, okay, or bathing, all right, related to um, the etiology or the whatever is causing that problem. Maybe lack of knowledge, limited movement, and low energy levels is causing that problem. And then what are the signs? Okay, so the nursing theory would guide you or help you shape your diagnosis. Okay, then it will direct your planning because some of the theories are prescriptive. Prescriptive in the sense that it tells you what to do for the patient to be able to meet the needs of the patient. So you set out your goals, you plan what you intend to do for your patient, as in you list out the interventions. Okay, you come out with the interventions of what you are going to do. So if you pick orange theory, it tells you the kind of nursing role that you can play in the patient's life. So it is wholly compensatory, where you are doing everything for the patient. That will help you to direct your planning because you know that for this patient, I have to provide everything and anything. I have to do everything for the patient. It can be partial compensation, okay, or partial compensatory. So here, the patient can do certain things for themselves, all right, and they will need help with certain things. So when you are planning, you set goals in collaboration with your patient and encourage or promote those self-care activities that he or she can do. And then the ones that she cannot do, you the nurse, you come in. So that is how the theory will direct your planning. And then it will also guide the care that you are actually what rendering. So rendering. So if you are uh, supposed to educate your patients on, say, uh, their provide knowledge on their medications, or maybe I said the person is hypertensive, so knowledge on how to their lifestyle, so how to modify their lifestyle. In that sense, if you are providing that knowledge, what are the things that you have to put in place? You have already planned, but how are you going to implement that care? So maybe your steps, you said maybe provide privacy, assess the patient's current needs when it comes to their previous knowledge. All right. You have also said that build on the knowledge that the patient has already shared, and then you go on and do all that. So by implementing, that was your plan. By implementing, you have to go along that same things that you have set out to do. And then you go ahead, you provide the privacy, looking at all the rationale and everything. You go ahead, provide the said care. And then you set out a goal. And with the goal, you have an objective that you need to meet. So at the evaluation stage, you are measuring the outcomes. And the theory helps you to measure the outcomes because if you pick Orange theory again, it tells us that if you are able to identify the patient's self-care needs, and then the self-care deficit, and you provide your nursing role, the outcome you are going to see is that you are going to see an improvement in the patient's ability to self-care. Okay, so the patients did not know how to do certain things on their own. Maybe grooming was a problem. If you are able to provide the care that the patient needs, grooming is going to improve, which will go a long way to also improve on patient satisfaction, will go a long way to also improve the patient's health outcomes. Okay, so you are going to use that, you are going to use the theory to measure the outcome. So it says that there will be an improvement in the patient's self-care agency. So the patient's ability to carry out self-care. So you are measuring, maybe you measure, one of your outcomes is that blood pressure would come down within acceptable limits. You do your evaluation to see whether you're able to achieve that or not. If you're able to achieve it, then yes, you've met your goals. But if you are not able to achieve it, you need to revise. What happened? Where did it happen? Was it at the assessment stage? Didn't I pick up some information that is going to help the patients? Or was it the diagnosis that I made? Was it wrong, or I did not consider another diagnosis? Or was it at the planning or the implementation stage? Then you go back and then adjust your care so that you'll be able to meet the patient's need. So that is how you apply the nursing theory to the nursing process. Okay, any question? Any question so far? Please, I hope it is clear. Any question? So we will look at a case, and then I will show you one last thing, and you will call it a morning. Okay, if there are no questions, then please let's look at this clinical application. So our patient is hypertensive. Okay, our patient is hypertensive. So if we are applying a theory, and here I have three theories. I have Orange self-care, I have Roy's adaptation, and then Peplo's interpersonal relationship theory that we are applying to the management of hypertension. Okay, now this is just aspects of it. Okay, if we are applying a full theory, we are providing holistic care. All right. So if it is hypertensive management, that if I'm applying Orange theory, there are several problems or self-care deficits I may identify. Okay. And then I will use her theory. So this picks just parts of it. Okay. So in managing a client with hypertension, like I was saying earlier, a nurse would assess the patient's self-care deficits and teach self-care. So what and what can be done for these patients to meet their self-care deficits, like I was saying earlier. Okay. And there is a study. I was trying to look for the article itself. I'm only finding the abstract, but I'll get the library to um, find this paper for us so that you can read it. So it's a study that was conducted in Iran, and it shows that Orange-based self-care education significantly improve hypertensive clients' quality of life, illustrating how theory-guided care can be effective. Okay, and this one I have personally used it in one of I took some courses at Legon. I've personally used Orem self-care theory to manage a patient who was non-adherent to their medications. And I want to show that to you. Let me quickly show that to you. Okay. I want to quickly show that's what I did for that work. Okay, so this was part of a course that was titled Independent Studies. And as part of what we were supposed to do for the course, we were supposed to nurse a patient and apply a theory. Okay, apply a theory. So if you pick um, Orange's self-care theory, there are several concepts. So we have the self-care agency, the self-care deficits, self-care demands, we have the nursing agency, and then all of these come into play to ensure that the patient's care is is holistic, if I can put it that way. I've explained what these things are. So let me just go on. So in applying Orange theory, please, I hope you can see. Let me put it on slideshow. Please, can you see? Hello? Okay. All right. So in applying the self-care theory, all right, I needed to assess my patients to see what the self-care needs are. And I was looking at medication adherence and medication non-adherence. Okay, that was what I was looking at. Just one aspect of the patient's needs. So when I assessed the patients, I thought that by prioritizing that one, it will help my patients. So I identified that I assessed the patient. I realized that adherence, medication adherence was the self-care. Okay, the patient could do it. And if the patient cannot do it, then it becomes a deficit. And I realized that for this patient, there was a medication non-adherence. So then I needed to develop a care plan that would teach the patient, address the barriers to adherence, and empower self-management. That is, the patients being adherent to the care to the medications that the patient was on. So what are some of the things that I did? This is also explaining Orange theory and how I identify some of the causes and risk factors for the patient's non-adherence. So I understood that the patient had a problem when it comes to her cognitive, and she has some form of cognitive impairment. Okay. And then she had lack of understanding. She didn't understand the medications, how important to adhere to them, when to take them, and all of that. She also had financial constraints. She couldn't afford most of the medications that she was put on. And then complex regimen. Those were the patients, the causes, and then the risk factors that my patient had. Okay. And then the nursing support systems that I was going to use was mainly the supportive educative system. So when it comes to Orim's theory, there are three roles that nurses can play: wholly compensatory, where you do everything for the patient; partial compensatory, when that is when you do certain things for your patient; and in the supportive educative system, you provide education and support so that the patient can go into it. So what are the practical steps that I took? So I did my planning, and these were my interventions. Okay, so medication education sessions, I didn't just do one, I did a couple. I educated the family as well. I asked for someone who can help her with her medications. Okay, so I provided medication education sessions. I had time to reassess the education so there was a teaching back and all of that. Then I also collaborated with the family caregivers. How? I look for the ones that can be available to provide support for the patient, even financially. Okay. And then there were some behavioral strategies that I put in place. And one of them was to integrate medication intake into daily routines. So, for this particular patient, we decided that for some of her medications, the one she's taking daily, my pharmacology antennas, were up as well. So we looked, I think she was on 5 different medications. Three of them were antihypertensives, and then the other two, what was the other two? I think one was an anti-diabetic. So she was on metformin as well, and then she was also on atorvastatin. So we sat down and then we planned which ones can she take with maybe breakfast, which ones can she take with lunch, can she take it when she's going to bed. That is how we planned. So another way of doing it was to talk to one of the family members who was um, technology savvy. Though this one, I couldn't achieve this one completely. I couldn't achieve it because I was in the hospital for a particular period. Okay. So there were some of them I was able to achieve. There were others that I was not able to achieve. But we were able to set times on the patient's phone, reminders, so that when she hears that particular ringing, it says that she's supposed to take her medications. I also advocated for patient-centered care, and this one, I collaborated with the nurses. So they should look at the treatment plan of the patient, consider her values, her preferences, and her abilities. They shouldn't just go in and just do what they can. Okay, they should look at that individual, that woman, and provide a culturally congruent care for the patient. And then I also talked to this one was hard because she couldn't pay for certain drugs. And so with this one, I talked to the social worker, I talked to the pharmacist, I also talked to the family members to come in to support her with her medications. And then we also looked at simplifying her medications. I consulted the prescribers to see if we can do combination meds for her. All right. I spent a short time, so it wasn't everything that I was able to do. But this assignment was only looking at the application of the theory to the patient's care. It wasn't really based on the nursing process, but if you look at it, everything that we have talked about, it was on how you can apply a theory to the patient's care. So looking at what we are supposed to be doing, go back to our lesson for today. That was just an example of how you can apply a nursing theory, okay? A nursing theory to the patient's care. Now, if you pick Roy's adaptation model, Roy says there are stresses in this life. And what nurses can do is to help the patient adapt to the stresses. Okay, that is what that is what her theory is about. And if you are applying it, they will see hypertension as a stressor, use it to assess the patient, to identify the various stresses, and then come up with their diagnosis and implement their plan and implement the care and evaluate. And in so doing, the patients may be able to reduce whatever is causing the stress, or there will be some supports that will help the patient manage with that stress. Peplo would look at this from the perspective of the nurse-patient relationship, where she say that if you establish a good rapport, a trusting rapport, a therapeutic relationship with the patient, it will help the patient to follow treatment plans and share concerns. So this is how we would be able to apply um, uh, yes, please, I will make it available. The slides will be made available. Maybe later this evening. I have to edit one portion. I thought I did it yesterday night whilst I was in the bus, but um, it wasn't edited. So I'll do that. I have to go and attend to the MPhil students. When I'm done, I'll do that and I'll share it later with you. Okay. So this is how we can apply the various theories to the nursing process. And if you're able to apply it, we're able to meet the patient's needs and then improve on the outcomes of our patients. Okay. Anyway, okay. So for some of my goals, they were fully met, especially the parts that I was providing education, collaborating with the family. Those ones were met. Those ones were met. But there were others that were not fully met. I had some partially unmet needs. I handed over to the nurse. One nice thing that happened on the ward was that I had some, so I went back to where I used to work. Okay. And went back to the wards, the two main wards that I was working. And so I met colleagues who are still in the clinical area. And as I applied Orim's theory, they were all, I mean, it was a wonderful learning experience for all of us because we know the theories. Okay, we know the theories, but applying it is the issue. And we think that the theories are some abstract something somewhere that you can also use I mean, you can only use for research. No, you can apply it beautifully to clinical practice. And in actual fact, the theories that we have, most of them were identified in the clinical area. Okay, in the clinical area. You wish to see me face to face. Definitely, in your 2 years here, we will meet face to face somewhere, either at your center or you come here. So we come to the center. So definitely, I don't know which center you are, but during the exams, usually we travel around the centers and you would see all of us. Okay, so Gertrude wants to know, I would like to kindly clarify whether we will be expected to apply theoretical concepts in our examination answers, especially in clinical case scenarios. Okay, so it depends. It depends. That is if I will do an essay. I have not decided yet. But if you do an essay, then yes. But even in the objective test, you should know the theories, all the theories that the curriculum says we should know. Yours is just a few. I mean, how many are they? If you go back to the your let me show you. This is where I'm coming to give you your assignments. I'll do that. I'll give a few instructions and put the rest on the on the page. I shouldn't give the apple. All right, I won't give the apple. Don't worry. Um, but I plan for us to do a quiz maybe next week. And so you find a few, you see how the theory questions would look like. Okay. All right. So I want to show you the course outline. I know some of us, we have still not gone through the course outline. I know very well that some of us, we have not gone through the course outline. So where is it? This course outline. There's one more topic that I have to take you through. I was hoping I'll be able to do that today as well, but don't worry. Next week, I'll finish the link between nursing theory and knowledge development. That is what the last thing we have to do. So we have 23 nursing theories. The last one I said is a reading assignment for you. The other theories that some of our nurse theorists um, adapted, okay, their theories from. So this one, I expect you to read, but we have 23, and because I have used Orim's theory now so much, no, I may take it out, and so we may have 22 theories, okay. Now, you are supposed to we are going to have 22 groups, 22 groups based on all the centers. For some of you, I've seen the list that you have shared with me, others too. You see, when I give instructions and you don't follow, it makes things difficult for me. I told the reps that they should post it on the page for me because honestly, time and I mean pressures of this Ghana, okay. When I see numbers that I don't know, unless the person calls me to tell me I've sent you something, I attend to those ones last. So it may take some hours, even days. I mean, and my fault. I don't live my life on WhatsApp or any other, but because it is work, and that is how we have the page set up for communication. Okay, so I was expecting that they share it on the page, and that was the instruction I think I gave at some point. Was it last week that share it on the page? But the reps decided to send it on their own. So I don't have all the lists yet. I don't have all the lists yet, but once I get it, I am going to put you in 22 groups. but it is going to be based on the centers. So let's say I have Tamale, and based on their number, I can get two groups from Tamale. I'll give you your topics. So reps, kindly drop it on the page for me. Kindly drop it on the page for me. So I'll share um the theories to you. I'll give you, you have this week and then the week after, okay, to prepare your slides. I'll give you a template, all right, and I would expect that you all go by it, the template, and then we'll start the presentations. So we'll start the presentations from next um, um, not next Saturday, the Saturday after. Okay. And we are going to time ourselves. And so I don't expect that you come and then you are talking plenty. You go straight. You see how um my my theory was applied. There's another one that I did some evidence. I did a revision of about five theories. Yes, I have another presentation, and that was. Let me show you that one as well. A little bit of it as well. So I reviewed five theories, and I had only um. oh, where's this one? I reviewed five theories. I had only 39 pages. Okay. So five theories. And the theories that I reviewed, I mean, it included a lot of things. The slides. So for each, I provided a background of the theorist. Okay. I provided a background of the theories, what the theory said, how the various concepts, how you can apply it and all of that, the strengths and the weaknesses. Okay. So that is how I went about it. And I did five of them. Five of them. So five different theories. And each theory, I used about just 4 or 5 slides to explain the theories. Okay, looking at their strengths, weaknesses, and then application of the theory. Okay, so I did five of them. I did Virginia Henderson. I'm not asking you to do five, please. Don't be scared. You are only going to pick one. Each group is supposed to pick one theory. Okay. All right. I will give you the instructions and everything on the Telegram page later today so that you can start working on it. Salifu, please unmute. Okay. Thank
Good
you.
morning,
The
madam.
rest. Good morning.
Please, about the names in the index numbers, some of our colleagues just joined. They just had their index numbers. I don't know how we're going to do it.
My brother, right now, I do also have an answer. I also don't have an answer to that. Okay.
Okay.
Okay. Please, madam, I don't know. It's a Telegram page. Okay, it's a Telegram. If you are not aware of that page with you, and then you join. So I'll take the what do you call them? The list that we have brought for now, and then I will assign. And then as and when they join, please, you see what we will do. Okay, but I'll take the list as I have now. Um, so I have Asankregwa, Takrade, Koforidua, Tamale, Keta. Oda, and then Wa. Where is the Kumasi list? Kumasi Center reps, kindly share your list as well. Okay. I will look at it and then assign them to you. Okay. With the various theories you are supposed to prepare, and one person will come and present on behalf of the group. Okay. On behalf of the group. They have also shared the Telegram link in the chats right now. Please do join. If there are no questions on what we have discussed today, I do believe, yes, yes, I'm not looking at the Orlando's theory as saying, just looking at how to just use that theory. I'm looking at applying all the other theories on the nursing process. That's the essence of this class. That's why I did not mention it. It is her theory, all right. Okay, but I did not look at it that way, because if you limit it to just hair theory, all right, then what happens to the other theories? How can you apply the other theories? Please, you are asking Loretta, you want to know how Peplo's theory will be. You will need to assess the patient using Peplo's theory before you can identify the patient problems and then use the diagnosis. Usually the diagnoses are quite, if you use the NAMDA, there's no specific, it's not like the self-care deficit ones. Okay, Peplo is more it's about the interpersonal relationship. So her diagnosis would tilt towards that. All right. Okay. Any more questions? If there are none, I have to rush to my MPhil students. We'll call it a day, and God willing, next Friday we would meet. But I will share the notes with you. All right. Your Telegram is not functioning. You are even lucky I did not sack you from the class. You are very lucky, Madam or Mr. Zoom user. So don't bring yourself, I beg you. Go and find a way of getting your Telegram to work, right? Okay, so thank you very much for joining me. Have a good weekend, and please know that Jesus is coming soon. In Chelsea, we have a game today. Pray for us because Burnley, to Michelle, enjoy the rest of your day. Bye.
É mais só. Bem, bem,